Good morning and welcome to Real Women, Real Issues. This morning I have with me Shirley Gray from Children's Hospital of Michigan. Good morning.
Good morning.
And welcome.
Thank you. Thank you for having me.
No problem. I wanted to discuss something with you. When a parent finds out that their child or children have an illness, what should they do?
Well, first of all, I think it really depends on the type of illness, if this is an acute situation or if it's chronic. Okay. And depending on the condition of the child and the impact that it have on the family, they first have to get as much information as possible. Exactly. And try to decide, make the decisions in terms of what come next, but stay as calm as possible, because we have to remember that the children do what they see. And when we are anxious, the children are anxious. And it's really difficult sometimes because we have grandmother and auntie all telling us what to do. So I think the most important thing is get the facts and get the information first in order to make the right decision.
Now, do you find that siblings can also play a part in that, how they act toward the child that may have the illness? Does that occur anytime? Would it help the child if they are anxious about it? Or, you know, for example, I have twin daughters. One has an illness, the other doesn't. And I find that the one that does not have the illness is like super mommy with her now. Did you take your medicine? Did you do this? You can't run. Don't go here. Don't do this. Is that common? Is that normal?
Absolutely. You find that the other child or the healthy child began to take on sometime the mother role or want to make sure that their sibling get better. But also we find that that healthy child sometimes will feel neglected. Because you are at that point spending much more time with the child who have an illness. And rightfully so, because that child requires more attention. So we have to make sure that we include the healthy child as much as possible. But also you have to think about the age of that child. You don't want to overwhelm either of the children. So you want to share the information at their developmental level.
To a limit.
To a limit.
And also I found out as of late that when I have identical twin girls, that I need to have the other one tested, because in this particular situation, it's like a 30-35% chance that she may come down with it also. So how do you do that in a manner of not getting her anxious or excited about it?
I think a part of that is how you explained it originally, again, at their age level, and you take them with you to the doctor's appointment so that they too can explain that to them. Now, at our hospital, we have what we call Child Life, and our Child Life services are experts that help a child on the developmental stages to understand the illness, to prepare them for the treatment, to prepare them for what is about to happen to them also.
Now, does the family get this counseling also, or is this just for the child who has it?
Absolutely. Family is always included. I often say that I have never seen a 3-year-old walk into the hospital and say, I need medical care. So when you have these type of complex problems, we have to treat the whole family. So yes, the families are included. It's very important for the families to understand what is happening in order for them to be able to communicate it to their children.
We'll be right back with more on children and illness. But first, we're going to go to Jungle Juice for the juice of the week.
Thank you, Ardelle, and welcome to Healthy Moments with Regina Hunter-Coleman.
And I'm Sarita Hunter-Doss. Today, we'll be making wheatgrass, which is the king of the king.
Wheatgrass is good for so many things. Just 2.5 or just 1 ounce is equivalent to 2.5 pounds of fresh green leafy vegetables. It has 103 vitamins, minerals, and amino acids. And of the 102 minerals known to man, it contains 92 of the minerals that the body requires.
As I make this, you'll notice that it takes quite a bit to get juice out of, but it's definitely worth the wait. It takes a little bit of time to get the 1 ounce that you need.
And if you're going to be making this at home, remember you'll need a masticating juicer. The centrifugal juicers don't work for this, so it has to be a masticating juicer, which is a cold press juicer. Oh. It's not my favorite taste, but it's good for so many things that it's worth doing.
Come do a shot with us at Jungle Juice Bar.
And remember, your health is your wealth.
Try the juice of the week and much more at the Jungle Juice Bar. The Jungle Juice Bar is located on Charlevoix in Grosse Pointe Park.
We're the Crone Law Firm. Firm, bringing more to the table. When we sit down together, we share our expertise. You've got a legal problem, we know you need relief. Advice that you can trust, that's why people come to us. We're the Crone Law Firm, bringing more to the table.
We fix hearts, we fix heads, we do eyes and ears, noses and throats. In fact, more children come to Children's Hospital than any other hospital in the state. Stop the headaches, stop the pain, fix the tummies, the ankles, the toes, and fingers.
Emergency? When it's your child, don't settle for less. Trust the pediatric ER experts at the Children's Hospital of Michigan at the DMC. The ER at Children's Hospital.
Always there, just for them.
My friends, I want to introduce you to Asco Financial. As attorneys, they worked hard to protect clients on a legal basis, only to watch many lose their money in the unpredictable and risky stock market. Asco Financial has recognized the need for asset protection for our seniors and has introduced investment planning that will grow your nest egg without the risk of loss. To find out more about how Asco Financial can protect your financial future, call 586-493-9989.
Real Women, Real Issues is brought to you by Mike's Fresh Market.
Welcome back to Real Women, Real Issues. I have Shirley Gray here with me today from Children's Hospital of Michigan. Hello again. I want to ask a question. And when children are sick and they have medication that they have to take and their younger siblings in the household, how do we prevent the younger children from getting hold of these medications or doing some harm to themselves with the medication?
That is a great question. First of all, you have to understand proper storage. And again, it depends on the age of the child. You want to keep your medication locked. You want to keep it out of reach. And you want to make sure that when you're given the medication, based on the age of the other child, you don't allow them to administer the medication. Sometimes we find that families will allow the child to give the other child the medication, and therefore, if they can reach the medication, they may end up giving a dose that they should not. So again, it's age specific, developmentally appropriate, but you always should know where your medication is, and hopefully behind lock key.
Now, how do you determine if a child is old enough or mature enough to medicate themselves, for instance?
I think that also depends on the condition that they have, and I would think this would be something that would be worked out with your care providers. And usually that's around the adolescent age. I wouldn't suggest a child much younger. And even if they are giving their own medication, they should be supervised by an adult. They should not do it independently.
So, for instance, in my case, my daughter is in high school, so she is older, and the dosages come throughout the day. Of course, she's at school at some point. She may have other activities outside of school. And at first, I was administering them, but then she decided and told me that she could do it on her own. And of course, I always call and check up. Is this something that I should not do?
You're doing very well. That is what we expect. As they mature and as they begin to take more control of their lives, and particularly if you're talking about a 15-year-old who eventually will be going to college in a few years. So you want to increase their level of responsibility. And sure, if you're comfortable and they are comfortable, by all means, keep checking. Because they need to know that mother is still involved, mother still care, and you want to make sure that she's not skipping any of those doses.
Absolutely. Now, when do you find the right age when they can go into the doctor themselves without the parent in? Because sometimes they, especially in adolescence, they may have some situations they don't want to discuss in front of the parent.
I think that, again, depend on, if you're talking about a high school student, I think you're pretty much at that age. But I think you should have that discussion with her. And you should also have that discussion with the physician. Because there are some things you want to know and you should know. There are other things that you really don't want to know, and they should be free to discuss that with their physician. Again, remember, you are preparing them for adulthood.
Absolutely.
So have that conversation with your daughter or with your child, and also have that conversation with your physician who's providing that care.
Now, that's another question I wanted to ask. Do you feel when you go into the doctor's office and your child has an illness and you do not know what the doctor is about to explain, and they go right into the illness or the what's going on with the illness in front of you and the child, and it may be something that you don't want the child to know. So how do you diffuse that?
I think you make it known to the physician. And remember, this is your child.
Right.
You know your child best. Right. And you also know what information you want and how much you want your child to know at that point. Right. So it's okay if you're in the room and the physician began to enter into a conversation with you and your child that you're uncomfortable. It's okay to stop the physician and ask the physician if you could have a private conversation. We encourage all parents to do that.
And then you have to know your child too, because some information might not be advantageous for the child to know, maybe not at that particular time.
Sure.
And of course, I believe, you know, everyone needs to be on the same page. The child, the parent, the doctor, the specialist, whomever, you know, is on the same page at the same time.
And certainly, you're the one that knows what's going on in your life.
Right.
You know the other factors that you're dealing with at that point. And we as professionals won't know that. Remember, we want families, and you should take control of your life.
Do you ever have to intervene with us?
Absolutely. I'm a social worker by training and have been at Children's Hospital for many years doing social work, and that's one of the things that we as social workers do. We work with families, we advocate for families, and we help them to get the information they need when they need it. And it's okay to be in denial. A lot of people say, you know, she's really in denial. Well, you know, denial is healthy.
It's healthy.
At some point, you need to be in denial, and you don't need that kind of information. So we are there as a team to help guide you through that.
I want to thank you again, Ms. Gray, for coming.
Well, thank you for inviting me.
No problem. You've given us a lot of information, and I'm sure everyone got some information out there that they can use. We'll be right back with more Real Women, Real Issues after this.